Good afternoon. My name is Dr. Randall Worth, Professor and Senior Associate Dean for Student Affairs and Admissions. You are making an enormous transition. This is the time you've been anticipating. You should mark these transitions since they're milestones in your life. Transitions are a time for reflection and being intentional about how you do things. Remind yourself of your previous milestones, how you achieved them, and who helped you get there. Donning of the white coat today marks the beginning of a journey for you in medicine. This transition marks you entering the clinical environment. You will see birth, you will see death, and you'll see everything in between. This time on your training journey will highlight your dedication to all the attributes you showed on your application to medical school. Do you remember what you wrote in your personal statement for your application to medical school? Hopefully things like altruism, professionalism, respect, and maybe most importantly, humanism. Read it today and see how you've grown over the past few years. Be reminded of these attributes and be intentional as you go forward. Remember to wear this coat with a sense of humility, that you are privileged to practice this science and art. You've accomplished great things to get to this point, but don't forget your humble beginnings. I wish you great success in your clinical education, and remember to take time to enjoy the journey as you travel this magnificent path. Now, it's my pleasure to introduce Rashmi Madhavan, who will welcome our Alumni Affiliate President.
And it is my honor today to introduce the President of the University of Toledo Alumni Affiliate, Dr. Patricia Metting. Dr. Metting has been an employee of the University of Toledo and the former Medical College of Ohio since 1978. She earned her PhD in physiology from the former MCO in 1980, the third of her degrees from the University of Toledo, which also include an associate's degree in respiratory therapy and a bachelor's degree in individualized studies with a focus on respiratory therapy. She has since been a professor of physiology and pharmacology here at the College of Medicine and Life Sciences, and now holds the title of Professor Emerita in the Department of Physiology and Pharmacology. Dr. Metting is a fellow of both the American Heart Association's Council for High Blood Pressure Research and the American Physiological Society's Cardiovascular Section. She's renowned for a lifetime of work in cardiovascular physiology and hypertension and its basic sciences. She is also the co-editor of Physiology, Pre-Test Self-Assessment and Review, now in its 14th edition. In addition to being inducted in the Gold Humanism Honor Society herself in 2005, Dr. Metting has been the recipient of many other prestigious honors throughout her distinguished career. As a student-focused administrator, she has received the Golden Apple Award and the Dean's Award for Teaching Excellence on the Health Science campus. In 2010, Dr. Metting was presented the prestigious Association of American Medical Colleges Group on Student Affairs Award for exemplary service. This Lifetime Achievement honor was given in recognition of her commitment to medical students and for her efforts to help them achieve their goals at a critical time in their lives. Dr. Metting has also been honored for her work in support of the Medical Mission Hall of Fame and medical missionary work at the University of Toledo. In her role, Dr. Metting has worked directly with students who participate in medical mission trips as part of their education. She has also been an active participant in numerous Medical Mission Hall of Fame induction ceremonies and is an enthusiastic supporter of the organization throughout the community. We are honored to have Dr. Metting join us today for both the Class of 2022's Gold Humanism Honor Society induction ceremony, as well as the Class of 2023's Student Clinician ceremony. Dr. Metting.
Hello, Class of 2023. Gold Humanism Honor Society members and resident Humanism awardees. On this 20-year anniversary of the Student Clinician ceremony at the University of Toledo and the 16th year since the founding of the GHHS chapter at UT, I bring greetings and congratulations on behalf of all College of Medicine and Life Sciences alumni. I'm Patricia Metting, Professor Emerita and President-elect of the Board of Trustees of your alumni affiliate. There are over 9,000 medicine alumni who are making a difference in their communities across the nation and around the globe. Through their generosity, the alumni gave you gifts of a white coat and stethoscope when you entered medical school. Now that the rising third years are transitioning into a new role as student clinicians, the alumni are delighted to provide you with a new white coat to start your clinical journey. The white coat, of course, is more than just a covering for your clothes and a place to hold your stethoscope and mobile devices. The white coat serves as a preeminent symbol of a standard of professionalism and caring, and as an emblem of the trust you must earn from your patients. Please remember this when you are wearing your white coat emblazoned with the logo of the Alumni Association, knowing you are a representative of this college, this university, and the medical profession. As you move through an exciting yet daunting time in your medical education, be assured that you are supported by the entire UT alumni community. Many of the faculty are alumni of the college, including your keynote speaker for today, Dr. Mohammed Musa, who serves as president of the Alumni Board of Trustees. Many other alumni are practicing physicians in Northwest Ohio who will serve as your clinical preceptors and mentors during the next 2 years. We look forward to supporting you as you accomplish many more milestones throughout medical school and beyond. Congratulations and best wishes.
Thank you, Dr. Medding, for sharing those words with us. Please join me and Samuel in the recitation of the Medical Student Pledge of Ethics. I publicly acknowledge and accept the privileges and responsibilities given to me today as a physician in training and dedicate myself to provide care to those in need. I will approach all aspects of my education with honesty and integrity, embracing opportunities to learn from patients, teachers, and colleagues. I will always maintain the highest standards of professional conduct. I will certify only that which I have personally verified, and I will neither receive nor give unauthorized assistance on examinations. I will value the knowledge and wisdom of the physicians who have preceded me. I will recognize my weaknesses and strengths and strive to develop those qualities that will earn the respect of my patients, my colleagues, my family, and myself. I will respect the humanity, rights, and decisions of all patients and will attend to them with compassion and without bias. I will maintain patient confidentiality and be tactful with my words and actions. I will value the diversity of patients' experiences, cultures, and beliefs because it enhances my ability to care for them and enriches my education.
I will not forget that there is an art to medicine, as well as a science, and that warmth, sympathy, and understanding are integral to patient care. I will strive to earn the trust my patients place in me and the respect that society places upon my profession. I will recognize the privileges afforded to me as a physician in training and promise not to abuse them. Even as a student, I have a responsibility to improve the standard of my health in my community, to increase access to care for the underserved, and to advance medical knowledge. As I accept these new responsibilities, I will not forget the importance of my own health and well-being. I will continue to value my relations with those who have supported me in the past and those who will share in my future. Knowing my own limitations and those of medicine, I commit myself to a lifelong journey of learning how to cure, relieve, and comfort the humility and compassion. I make these promises solemnly, freely, and upon my honor. And now, I'd like to introduce Dr. Obi Ekwana, Assistant Dean of Student Affairs.
I have many favorite quotes that I draw strength and motivation from in my journey as a physician and caregiver. One of my favorite quotes, "Don't count the days, make the days count." This is attributed to Muhammad Ali, the famous boxer. The journey of becoming a physician is a long one. Some of you went through high school, undergraduate, and now in medical school, and residency is in the future. Some took time off, medical school, undergraduate, had other careers, and then now you're here on this path to becoming a caregiver. You're a caregiver once you put your white coat on. Many patients will not see you as a third-year medical student on this long journey to becoming a physician. Many will see you as the doctor. So I urge you to make the days count as you step into this role as a student physician or a student doctor. Make it count for your patients who may see you as that doctor who sits to listen and learn about other aspects of their history of present illness that leads to an elusive diagnosis. You are part of the team. What you do matters. What you say matters. How you say it matters. You matter. Finally, it has been a long 14 months or more with COVID, social and racial injustice, tension all over. You've been tested in many ways that you could not have imagined. We all have. Your patients have as well. Take time to learn about your patients, where they come from, who they are, what they like, what they want, what their hopes and dreams are. These interactions that you will have with your patients, they heal, they nurture as much as the IV medications and other therapies you may prescribe. Your journey to becoming a caregiver is here. Your journey to becoming a doctor is here. Enjoy it. Finally, congratulations to the Gold Humanism Award recipients. We are proud of you. You represent the best and the future of what being a caregiver is about. Take care. Bye-bye.
Thank you for opening the ceremony, Dr. Ekwana. My name is Clay Rice. I'm a graduating fourth year going into family medicine, and I myself was inducted into GHHS last year. And what a year it's been, right? At this point, I'd like to insert a joke about COVID-19, but I'm afraid it might come across as tasteless. And why is it called the novel coronavirus anyways? Well, it's a long story, but all jokes aside, I'd like to take this time to welcome you to this year's Gold Humanism Honors Society induction ceremony. It is my great pleasure and privilege to introduce our keynote speaker. He's a Toledo local, born and raised. He went to the University of Toledo for both undergrad and medical school, and then completed an emergency medicine residency at Henry Ford. He then returned to the Toledo area and worked at Mercy St. Vincent's for 8 years before accepting a position here at UTMC for the past 5 years. He's an associate professor of emergency medicine, is the program director for the residency program, and is the president of the UTCOMLS Alumni Affiliate Board. He and his wife Sabrina are proud parents of their 4 children, Ali, Amal, Lena, and Essa. Please join me in welcoming Dr. Musa.
Dear rising third-year medical students, I want to thank you so much for inviting me to be your keynote speaker for this amazing format for the Gold Humanism Honor Society at your student clinician ceremony of 2021. When I was asked to do this, I really was honored and made me feel so happy. So thank you so much, especially as an alum of this awesome medical school. And I'm talking to you today simply as an ER doctor, taking care of patients on the front lines during and after this, hopefully after this pandemic, this COVID-19 pandemic. And you're looking at me as an ER physician. I'm wearing my scrub tops without any fancy tie or jacket. And that's because I want to tell you how important it is to stay connected with your patients and demonstrate empathy and compassion. And what I want to talk to you about today, and I really hope you get my message, is I want to share with you a story that occurred recently with a patient that I think exemplifies the humanism that is associated with the Gold Humanism Honor Society and why you're a part of it. So I want you to take yourself with me to an emergency department, and I had a sickle cell patient present in intense pain. We all know that sickle cell patients have tremendous amounts of body pain, and they require strong pain medications to get them through these exacerbations. And I was in there with my nurse, with my team, assessing the patient, and we told her about a protocol where we want to give our patients medications, pain medications within 30 minutes of arrival, quickly. We want to treat their pain. We do that for like cardiac, myocardial infarctions and strokes, time to intervention, right, within 30 minutes. And I felt when it comes to pain, that's the main thing we want to do for our patients. So we talked to her and told her that we want to give you pain medication within 30 minutes, even if it's simple medication like acetaminophen or ibuprofen. And we all know that those are weaker pain medications compared to some of the stronger medications like narcotics or other meds that they require. So when we were having this discussion, myself and the nurse and the patient, my dear nurse offered to the patient and said, does it really mean much to you that we're giving you medications up front early on that might not help you, that might not be strong enough, that you still might need the other pain medication? And there was almost a moment of silence, and the patient looked back at us, looked back at the nurse and said, yes, it matters, because it demonstrates that you care. And that's the whole point of what I want to reach out to you today, is that we have to demonstrate that we care this day and age in medicine. We're in a very depersonalized format in medicine these days where patients are numbers and barcodes, and we have to remember that our patients are humans, that they have pain and feelings. And if we don't grasp that from the beginning, we're going to miss out. And I will tell you, I could not succeed as a physician in the emergency department if I cannot get in touch and empathize with my patients, letting them know I know what they're going through. Maintaining my position as a physician, listening to them. Yes, I do all of the big, bloody, gory things in the ER like intubations and resuscitations and cardiac arrests, but none of that matters if I can't tell the patient how I understand what they're feeling. They have to know this. This helps their stress levels. This helps their anxiety. It makes them feel that they're being listened to. Oftentimes, the therapy is not a pill or a tablet or medication. It's what you say to them. It's what you show them. It's letting them know that you listen. And sometimes you're only in the room for a few minutes, but to them it's an eternity because someone is listening to them. Pain is something that we have to address all the time in whatever way we can for our patients. So as you embark into your clinical years here in the next couple years, keep that in mind. Stay in touch with everything that you've learned before. It's not a good idea to become a physician and forget all of the empathy and care that you're going to learn along the way. The same way that a farmer puts their hands into the soil and the dirt every spring to get an idea of what the ground is going to be like, you have to do the same thing with your patients and keep close connection with them. Listen to them, let them talk to you. Sitting down, you hear this all the time, but literally sitting down at their level and letting them know that you're listening to them matters tremendously. So this is my message to you as these exciting third and fourth years come about, and then on to whatever branch of medicine you go into. And I will repeat what I've said before. It's going to be very difficult to survive as a physician in any discipline if you cannot employ that empathy for your patients. And guess what? Once you employ that, it's very positively contagious for your coworkers and colleagues that you're working with. Trust me, it's one of the best experiences you can have when you can have this positive, empathetic impact on them. Want you to study hard, learn, become the best at whatever you want to do, whether it's cardiology or internal medicine or emergency medicine, but you need to factor in empathy. It has to be there to keep you grounded, to remember everything about your patients and what they're going through. Again, I just want to let you know that I'm so honored to have been invited to this ceremony. I'm so excited to see you working in the future with me and others in the emergency department. You guys have done a wonderful job this year, considering the pandemic has put so much stress on you, and sometimes you don't know what the plan is going to be for the next few weeks ahead of you. But look at this as a test, as a challenge that you're going to overcome, and years from now you're going to look back and say, wow, I made it through this. So once again, I want to thank you for inviting me from the bottom of my heart to this amazing humanism ceremony where you get your white coats and get to carry them and wear them. And please don't hesitate to reach out to me. Thank you so very much, and good luck.
Thank you, Dr. Musa, for those inspiring words. I would like to share with you the qualities of a humanistic physician and teacher. Consistently demonstrates compassion and empathy in the delivery of care to patients. Serves as a role model and illustrates professional behavior for students and colleagues by example. Is approachable and accessible to students. Welcomes opportunities for teaching and one-on-one mentorships with students. Exhibits enthusiasm and skill in professional and personal interactions with students. Shows respect for everyone he or she comes in contact with. Demonstrates cultural sensitivity in working with patients and family members of diverse ethnic or religious backgrounds. Displays effective communication and listening skills. Understands a patient's need for interpretation of complex medical diagnoses and treatment and makes an effort to assure patient comprehension. Shows respect for the patient's viewpoint. Is sensitive to the patient's psychological well-being. Effectively identifies emotional concerns of patients and family members. And now I'd like to introduce Hannah Kennedy and Cody Klinker, who will announce the Arnold P. Gold Foundation Humanism and Excellence in Teaching Awards.
The Arnold P. Gold Foundation Humanism and Excellence in Teaching Award is given to up to 6 residents selected by the members of our third-year class based on their demonstrated commitment to teaching and compassionate treatment of patients, families, students, and colleagues. Here are the 2021 recipients and some attributes for why they were selected. First, Dr. Ashu Akaraya, an internal medicine resident. They are being nominated for being a kind, compassionate resident physician who goes above and beyond to teach students and help them improve their clinical skills. Second, we have Dr. Joseph S. Alacuson, a pediatric resident. He is an amazing team leader and makes very efficient use of the students' time on the wards. Now, Hannah.
Thank you, Cody. The additional resident recipients are Dr. Nassar Ali, a resident in the Department of Neurology. He was nominated by a student because he's the best resident they have ever worked with. He finds time to help students succeed, and as students, we want to reward him for his consistently selfless actions. Dr. Mark English Jr., a resident in the Department of OBGYN, provides great feedback when teaching students. He's also welcomed and integrated students into the team. Dr. Irfan Sahil Sheikh, a resident in the Department of Neurology, was nominated by a student as by far the most involved and understanding resident they have ever had the honor from which to learn. These are just some of the reasons these 5 residents were nominated by the class of 2022 for the Arnold P. Gold Foundation Humanism and Excellence in Teaching Awards. Now I'd like to introduce Leica Vemaru, who will be introducing the class of 2022 GHHS inductees.
My name is Leica Vemaru, and I'm pleased to introduce the new Gold Humanism Honor Society inductees for the class of 2022. Sarah Benson, Jenny Chen, Gabrielle Fernandez, Yasmin Gore, Zachary Holtzapfel, Nadia Irfan, Ellen Jokum, Milani Kekulawala, Hannah Kennedy, Joanne Kilbane-Myers, Cody Klinker, Nathaniel Locke, Sean Mack, Rashmi Madhavan, Michael McHugh, Felipe Mejia Miranda, Anthony Mitchell, Susan Morand, Nile No, Carly Polson, Rebecca Potts, Paige Prologo Richardson, Supraja Rachuri, Nithya Raya, Samuel Stetkevich, Claire Wilson. Congratulations to you all. Now I would like to introduce Christina Varghese, who will lead the recitation of the Gold Humanism Honorary Society Oath.
Hi everyone, my name is Christina Varghese and I'm a GHHS member of the class of 2021. Together with the class of 2022 members, we shall recite the pledge. As a member of the Gold Humanism Honor Society, I pledge to be a role model and mentor for humanism in medicine,
champion the proper balance between scientific and humanistic patient care,
Inspire colleagues to promote humanism throughout the healthcare system. Advocate humanistic patient care locally, regionally, and nationally. Nurture fellowship and membership. Help those struggling to overcome the barriers to humanism in medicine. Be a force for improved healthcare for everyone. Congratulations, Class of 2022 Gold Humanism Honor Society members. Now I shall hand it over to my fellow classmate and GHHS member of the Class of 2021, Allison Garron.
Once again, congratulations on the great accomplishment of being inducted into Gold Humanism Honor Society. You should be very proud of how far you have come and what you will achieve in the future. I would like to leave you with a few closing remarks to motivate you to continue promoting humanism in medicine moving forward. First, I want to remind you that induction into the society does not mean that today you get this award and it's nice. Induction into this society should serve as a constant reminder of the future of how you want to be as a physician. Second, remember to never take humanism for granted and prioritize it over other components of medicine. You will be busy and you will interact with many patients throughout your days. Don't let these interactions just be another patient to you, because for the patient, that interaction is their life, their health, their future. You can be the brightest of doctors, but if you fail to connect with your patients, you fail to be the best doctor that you can be. Lastly, I want to encourage you to continue to be beacons of humanism in medicine to your peers. You would be surprised how much you can lead by example and, as a result, encourage those around you to carry out the same sentiments. I would like to leave you with a haiku written recently by a medical student as part of the Gold Humanism Honor Society's Golden Glimmer Initiative. Breathe deep, I promise. Medicine will change you, but you will change it too. Congratulations, Class of 2022 Gold Humanism Honor Society inductees. I'm excited to see all the ways that you will change medicine. And now I'd like to introduce Dr. Christopher Cooper, Dean of the College of Medicine and Life Sciences and Executive Vice President for Clinical Affairs.
Hi, it's really great to be able to address you today as we close out the Student Clinician ceremony. You're about to start an exciting phase in your medical education when your training shifts from the fundamentals of practice of medicine to the actual care of patients. During this time, knowledge acquisition remains critical. You're still going to have to study. One of the things I was told when I was in my fellowship training was that the eye cannot see what the mind does not know. So what does that mean? You're going to need to read a lot. You're going to need to study, and you're going to need to learn. It matters, and now not just for the test. It also matters for your professional success and your professional reputation. That will follow you throughout your life. You'll also find out that the faculty, the residents, the staff, and your fellow students will quickly learn what type of professional that you are. Are you prepared? Do you know about things? Do you read? Or are you just there for the ride? In addition, your work habits will now be on display for everybody to observe. Up until now, you've had the anonymity of a classroom student. Sometimes you didn't go to class, sometimes you watched the lectures at home, and maybe on double speed. Now, though, things are different. Now other people will keenly observe how you do your work. Interestingly, the most keen observers will be the patients that you care for. They will quickly determine if you are really listening to them, if you are diligent of your examination of them, if you discussed with them thoughtfully your findings, and if you were responsive to their needs and the treatment plan. Also, during this exciting transition, you're going to learn a lot more about life. Your patients share with you the most intimate details of their lives with you. In my time, I've had patients share what it is like to be in a German concentration camp and lose all of their family, then wander through post-war Europe to find a home when all had been lost. Or what it's like to be an American airman shot down over Austria and spend the first 4 years of your marriage in a German POW camp. Or to be a German soldier walking back from the Russian front to Austria barefoot. You see, my patients have shared those stories with me and those details because they thought it was part of who they are. It was a critical part of their life, which those experiences shaped. Experiences like these have shaped their mental and physical health, and they have shaped their resilience in a health crisis. If you're smart and wise, you will learn from your patients about health and disease. More importantly, though, your patients are going to teach you about life. Also in this time, you need to take care of yourself. You're going to work a lot during your clinical time. It's hard work. There's a lot to do. Patients are sick. They need your attention. There's a lot of reading and preparation. It's a hard lesson to learn. However, in the midst of this, you need to take care of yourself to endure and succeed. You need to eat. You need to go to the bathroom. When you get a chance to sleep, you need to do that. You need to exercise. And in contrast, there's some things you need to avoid. Don't use alcohol to relax or wind down. Don't use drugs to wake up or put yourself to sleep or to relax or to take the edge off. I will say that no one intends to become drug addicted or an alcoholic, but yet each year some do. And you're not immune. Intelligence is not a defense. There will be times as a student or a resident or a practicing physician where you may be absolutely exhausted. Remember that a shower, getting something to eat, going to the bathroom, these simple things may be enough to get you back on track and get you through. In closing, I'm really excited for you. This next week starts a wonderful time in your life. Enjoy it, study hard, know that others will be keenly watching how you work. Learn about life from your patients, take care of yourself, and also know that we, the faculty, are here to help you and to guide you. There are many of us looking out for you during this process. Your faculty, the clerkship coordinators, the clerkship directors, the faculty and staff and student affairs, and the dean's office staff. We're committed to your success, and we are here for you. Enjoy this time.